Hi, my name is Debbie, and I am obsessed with all things to do with ultrasound. I'm an empty nester who has spent the last 28 years scanning in all different kinds of situations: clinics, hospitals, point of service, emergency departments, private offices, echovascular, general, high risk OB, and want to dive down deep into all things to do with technology, techniques, and transformation. It's time we take ultrasound to the next level. Think of this like your little power boost on your commute to all things ultrasound, along your way to the thing that we call work. So pull up a seat, make sure you're comfy, and be ready to be challenged and encouraged as we learn it's all about the frequency. Today, our guest is Brandy Bach. She is currently the Sonographer Program Director at Tarrant County College in Fort Worth, Texas. Brandy began her career as a radiology technologist after graduating from TCC in 1990. She continued her education at Dallas County College, where she studied sonography. She went on to complete her Bachelor of Science in Healthcare Administration and her Master's of Science in Instructional Design and Educational Technology. In her 34 years as a sonographer, she has worked in various hospital and clinical settings. She also worked in commercial ultrasound. She has spent the past 17 years in sonography education. Brandie enjoys volunteering for several different international organizations that promote sonography education. She has been fortunate to work on 7 different international medical mission trips. Please help me welcome Brandy Bach. Brandy, thank you so much for joining us today. Our topic today will be about global sonography, and Brandy has a ton of experience in this, and I'm excited to talk to you about this. Can you tell us maybe a little bit, first of all, just how you got started in ultrasound and why you chose ultrasound to be your career?
Oh, well, thank you for having me. I started ultrasound. I went to x-ray school back in 1990 and got exposed to ultrasound through radiology school. And as soon as I finished the radiologic technology program, I applied to sonography school and never looked back. So I've been doing ultrasound now for about 34 years. And I've been doing, I still work clinically, but I've been teaching for 16 years. And I've been doing medical mission trips now for almost 10 years.
Wow,
Yeah,
it's a lot.
it's a
Pretty
lot.
cool. Teaching, hands-on working, and global travel. That's
Yeah.
amazing.
It's a good mix.
It
Keeps
is a good mix.
keeps me
Yeah,
from getting bored.
I bet. I
Yeah,
bet.
yeah.
Where do you want to start? Let's see. I think there were several different types of medical missions, right?
Uh-huh. Yeah. So
Maybe
I've been
we
on.
start there.
Oh, sure. I've been on several different international medical mission trips. I've gone on ones that are surgical, where we created AV fistulas and done vein mapping. I've gone on ones that were treatments. So Trinidad and Tobago, we were there for the Zika crisis and helped pre-screen babies and educate the sonographers there on what to look for on the markers on babies that had Zika. And then a lot of the ones that I've been doing recently are teaching. So I've done 3 with Mercy ships. And I just got back from Albania last year. That was a teaching mission trip. But I'm going to Guatemala in 3 weeks, and that's more where I'm working as a sonographer. That's less teaching and more clinical. So there's all kinds of different types of medical mission trips, and I enjoy them all.
Wow, that's amazing. So, um, what kind of time commitment is this for a medical mission trip?
Well, it's usually a minimum of a week. When I go to Africa, they usually want 2 weeks, and that's pretty reasonable because it takes, like 26, 28 hours to get there.
Right, right.
So what I usually try to do so they don't affect my job too much is book them over spring break. So I only miss either the week before spring break with my students or the week after spring break with my students. So part of the 2 weeks falls over spring break usually.
So
Yeah.
you get to choose when you go then.
Sometimes the Guatemala one was already predestined. The doctors kind of already worked it around and then asked me if I was available. Same thing with the Albania one. They had already planned that one and then they asked me if I was available. But if it's a 2 week commitment, then yes, usually I've got a bigger say so.
Nice.
Yeah.
Nice. Huh. This is so fun. All right. So tell me, what kind of things do you do before you go on the trip to prepare?
That's a good question. So if it's a teaching mission trip, I usually do like a needs assessment. I kind of find out who my target audience are. Are they nurse practitioners? Are they radiologists? Are they OB-GYNs, vascular, echo? And kind of do a needs assessment on what they already know, because a lot of them already know how to scan and they're just wanting to brush up their technique. And then some people don't know how to scan at all. So I kind of try to meet them where they're at. So I do a needs assessment and then I kind of come up with a training schedule. So we do lecture usually in the morning and we usually do a lab in the afternoon and have either they practice volunteering scanning on each other, or sometimes we have, if we're at a clinic, they'll have their patients come in and we'll scan the patients. But we usually do labs in the afternoon, scan labs in the afternoon. And then we usually do a post evaluation to see if we bridge the knowledge gap there. So those are for the teaching mission trips. If we're doing like a surgical mission trip, then we do a needs assessment, but it's a little bit different. We find out if they have the things that we need to do. Like for the fistulas, the physicians brought their own OR trays and their own things and the things they wanted to do, the AV grafts, because the facilities that we went to didn't have those types of materials. So that's a different type of needs assessment. So we either do a supply needs assessment. Do they need gel? Do they need sterile transducer covers? What do we need? And then if it's a teaching one, we do a needs assessment to try to find out who the target audience is, what they need to know, and what equipment they have. Because I've had them ask me to teach them, venous Doppler for DVTs, and then they didn't have color on their machine. So I learned very quickly to start asking, do you have Doppler? Because we take that for granted here. Everybody has color.
Right. Mm-hmm.
So
Yeah.
I need you to send me a picture of your machine. I need you to send me a picture of the probes. All the probes work? And sometimes I'm able to take a couple of machines. I have a couple of laptops through some friends and some organizations that I can take sometimes. But if they have their own machines, I'd rather they learn on what they have.
Right.
Yeah. So those are just some of the things we do when we prep.
Wow. Yeah, and I noticed in your notes here you mentioned flexibility is key, right?
Oh my gosh, I cannot tell you. You have got, and I'm usually kind of a type A kind of person, but you have to have a backup plan and a backup plan for the backup plan. The travel never goes, international travel, if you've ever done it,
Right.
There's always a couple of hiccups. And if you're doing a third world country, there's even more.
Right.
I've never gone on a medical mission trip that I got there and returned on the same flight that I was booked on. Always something happens. So you've got to be flexible with that. And you've got to be flexible with their schedules. They don't run on American time. Like if I say we're going to be in the classroom in 10 minutes, that's an hour to them.
Right.
So
right.
you've got to, it's their country, it's their rules. So I have to remind it's a lesson in patience for me. So
Yeah.
So you got to be very flexible with the training schedules.
Right. Have you had any trouble with getting qualified or good interpreters?
No, not really, because they know that I'm coming. So like if it's with Mercy ships, they have a translator there for me, and I usually send my PowerPoints. If we're doing a teaching one, I send my PowerPoints ahead and they translate them for me. And most of the physicians that I teach, no matter what country I go to, they speak English, but it's not their first language. So they're more comfortable in their native language. So I'll be, one of the slides will be in English and the other ones they'll be in French. And because most of the African countries I go to speak French.
Right.
So then the translator will be reading off of it, but they're still understanding me. They just feel more comfortable in their language.
Right.
So that's fine. And sometimes we have some language barriers. Like sometimes things don't translate like a saying or just medical terminology that we use that maybe they don't use. So yeah, it's always helpful to have a translator.
Yes. Yeah. Even when you think you don't need one, it's always good to have one.
Yeah. Sometimes we use slang here that doesn't land the same.
Right. You have to be careful with that, right?
Yeah, you do.
And I even remember, I've done a few medical missions as well, and one person said, well, you don't really need an interpreter, do you? And I'm like, I'm putting a probe into her vagina. I need an interpreter. I need permission to do that. Like, and she needs to know that's what I'm doing. I
Absolutely.
absolutely need an interpreter, right?
Yeah.
Um,
And that speaking of that, that's another learning curve when I go to some of these. They don't clean the vaginal probes like we do. They don't have trophons. They don't have, the gust stations that we had before the trophon. So
right,
I try to bring wipes and educate them as much as I can on how we do things here. I can't guarantee that's how it's going to be done when I leave, but
right,
I
right.
really try to preach infection control, but they just don't have the materials there to do everything we do. So it's kind of cringy sometimes, but I'm there to try to improve what they're doing.
Awesome.
Yeah,
Awesome. What about food while you're there?
that's a good question. So they usually have food, but it's not usually what you want. Now, when I went to Trinidad, which Trinidad and Tobago, that was mostly kind of like Cuban food. That was good. Albania had the best because they sit right by Greece and Italy. But Africa, uh, that's a whole different thing. We had lentils and rice almost every day. So, I usually bring like granola bars and trail mix with me just because in case I don't care for their food. I always try it and I don't want to be rude and not have that with them. But
Right.
I'm usually back in my room eating a couple granola bars and some trail mix before I go to bed.
Yeah. Yeah.
Yeah.
And water. You have to be careful with water intake, right? So,
You have to be so careful with water. I learned that on my first trip to Africa. I was so sick, and one of the Mercy Ships doctors like, "Well, did you drink the water?" And I said, "No." And he's like, "Did you put ice in any of your tea or your soda?" And I said, "No." And he's like, "Did you brush your
brush
teeth
your
with the
teeth.
tap water?" And I said, "Yes." And he's like, "That's it." So
Yeah.
now I put a towel over the sink because it's just habit that you run your toothbrush under the sink.
Right. Right.
So yeah, I don't do that in any of those countries anymore. Use bottled
Yeah.
water.
That's how I got there too.
I never even thought of it. I thought, well, I'm not drinking the water. It didn't even,
Right. Right.
yeah,
And it's good for them, just not for us. Like our
yeah.
guts just are not prepared for that.
No, our GI system, it was a major shock.
So, what are some of the benefits of a medical mission?
I think, well, besides giving back to, your community and just your profession in general, it really helps you. It helps you become a better sonographer.
Mhm.
It makes me have critical thinking skills that, we take for granted here. Like, for example, they brought a machine that the hospital that didn't have color Doppler that really wanted to know how to do DVT studies. They said, well, if we bring you a machine with color Doppler, can you teach us? I said, sure. So they went to a whole nother village, loaded up a machine on a pickup truck and brought it to where we were. And I looked at it and all the buttons are in French. So,
Right.
it's like I teach my students, you can go to any clinical site. It's like a rental car. They all have the same buttons. You just like a windshield wipers on the rental car. You can figure it out. But all of the buttons were in French. The only one that I knew right off the bat was the freeze button had a snowflake on it.
Okay.
So that was a huge learning curve trying to figure that out. But yeah, I think it enhances my critical thinking skills. It makes me think outside the box. And they teach me as much as I teach them. They do a
Absolutely.
lot of MSK because they don't have MR like we do. So
Right.
they do a lot of MSK studies. So they teach me some things about that. I learned lung ultrasound over in Kenya because they don't have chest x-rays for malaria and TB like we do. So they do a lot of lung ultrasound. So they taught me
Ah,
about the A lines and the B lines, and so they teach me just as much. So I really enjoy it. I always learn something, and I mean, either culturally I learn something or just emotionally about our job and working with patient care. But I always learn something about ultrasound. They always come back and teach me something I didn't know.
yeah.
Yeah.
Yeah. And just so much, so grateful, you
They
know?
are grateful. Like the World Health Organization says that less than 75% of the world's population has access to diagnostic imaging, which is crazy because here in
Right.
the United States, like there's, an urgent care on every corner and every
Right.
ER orders ultrasounds for every little, stub toe we get ultrasound orders for. And so it's crazy how many people don't have access to what we have. So they are so grateful when we bring something to teach them and educate them. So they're,
Yeah.
yeah.
Yeah. But just even grateful for what we have. Like, we could just, anybody can walk into a gas station and use the restroom and have clean water to wash their hands, right? Like the fact that they don't, and then my medical mission was in Honduras. And so just hearing some of their stories about how they tried to make it over to the US and they got sent back or they got put in jail and they got put in jail 3 times. So now if they go back and they get caught, then they're in jail forever or something like that.
Oh, definitely. The first time I went to work with Mercy Ships, they were telling me about all these OB patients they have that have obstetric fistulas. And I've been doing OB ultrasound for years. I'm like, what's an obstetric fistula? And they're like, well, that's where there's an opening, between the vagina and, the urethra or the rectum. And so urine and feces just spill out because these women were in prolonged labors. We're here, we would either do an episiotomy or do a C-section. And it just created that opening. And once they have that opening, they don't have the means there to surgically fix it. So these women
Right.
get ostracized from their families. Oftentimes the babies die in childbirth through this process. And then they get ostracized because they're unclean. They're incontinent. And
Oh,
so Mercy Ships, the surgery is only like a 30-minute surgery. Here it would be nothing, but these women travel for days and wait in line just to have this one surgery. And it's amazing how much we take for granted. Like in the United States, that would never happen. A woman would not labor for 4 days like that.
right, right, right.
So yeah, it's crazy in 2025 when you see what other people have. I always come back much more grateful for what we have.
Yeah,
And a lot of people complain about healthcare, and I'm like, but you haven't seen what the other people have. I mean,
right,
yes,
right,
our system has things that need to be fixed, but
right,
it's better
right.
than what I've seen.
Well, and I even remember walking into their OR and they're like, wait, you need certain scrubs and blah, blah, blah. And I'm like, oh, yeah, I do. But it's just so dirty over there that who would have thought that you consider this sterile?
Oh,
No, they
yeah,
considered that sterile. And I'm like, it's just so dirty.
100%.
You
They,
know?
here, I don't think we've reused needles since like the 70s. Everything's
Right,
disposable, especially since, the HIV pandemic.
right,
We don't do
right,
recap needles. They reuse needles there because they don't have them. These patients have to purchase their own stitches and their own needles and stuff before they have a surgery or they can't have it. It's crazy.
yeah.
I saw when I was in Jamaica, their crash cart was a shoebox full of just random medicine that was thrown in a shoebox. I took a picture of it. I always take pictures and show my students when I come back. So I'm like,
Yeah.
our crash carts look like something at Home Depot, those big red
Right,
carts with all the,
right,
they literally have a shoebox like I have in my medicine cabinet of just random medicine.
right,
Just
right.
like crazy. And that's what they have.
Right. And it makes me take really good care of myself before I do go to one of those places because I don't ever want to get caught to need help when I'm over there.
Definitely,
But
definitely.
yeah, so have you ever been on a trip where you were worried about your safety?
Only one where it was a little bit unsafe, and Mercy, that was again with Mercy Ships, and they had our translator was also kind of our bodyguard, so he stayed with us the whole time. Just because I I was so naive, I'm like, well, how do they know that I'm a foreigner? And they're like, okay, you're a white girl with blonde hair.
Yeah.
You stand out. You
Right.
stand. I just, I've been there. I didn't think about it. And they're like, you just stand out.
Yeah.
So they just don't want you to be targeted as, for it, not anything necessarily violent, but even just a pickpocketer or a scammer. So
Oh,
yeah,
I see.
they pretty much
Yeah.
stayed with us the whole time.
So my experience in one of my trips in Honduras was that a lot of times there's a lot of upheaval and disrest in the country, right? Because the dictator who's in charge is so evil,
Mhm.
like he will turn their water off sometimes. And I'm thinking, oh my gosh,
Those are things
I
we
can't
don't.
imagine living without water.
No, those are things we don't think about. And back in 2019, I was supposed to go to Haiti, and about 3 weeks before our trip, these things they don't. People always are like, "Oh, you should invite me next time." Do you realize that we plan these like a year out?
Right,
It's
right.
nothing I just decide. But so about 3 weeks before we were to go on the Haiti trip, they had a major political unrest, and I'm like, "Oh, that'll blow over." It's still going on. It's almost 7 years later, and they still don't have anybody going in to do medical mission trips because,
Yeah.
the United States government says it's not safe
We
right
ended up
now.
having to leave early
Oh,
because
wow.
we were afraid that we might get stuck there while that political unrest started to evolve. And we actually passed by the president's piece of land or something,
Oh,
and a armed security guard would get on our bus and inspect everybody on the bus, you know. That was a little unnerving, you know.
I will say the countries I've been to in Africa, the police there are they look military. They've got, the machine guns on them and they're
Right,
all in camo. And I
right.
mean, I made the mistake on one of my first trips to Africa of taking a picture of them because, I have a police family here. So I thought, oh, they want to see what a police officer looks like in Senegal. That police officer took my phone. I thought he was going to keep it. And he deleted the pictures off of it and scared the crap out of me. And I'm like, I won't do it again. I'm so sorry, but that is just not allowed.
Yeah.
I'm just like a little tourist just taking my pictures and
Yeah.
no.
Yeah.
Okay.
Yeah, so there's a lot to consider, right? You know, the team's personal safety, because we had several OBGYN surgeons, and several nurses and surgical crew and ultrasound. And so it was a good sized group, you know,
Hmm.
and the interpreters that we had were talking a little bit about it. And so that's kind of what tipped us off a little bit to, well, maybe we should leave a little earlier, you know.
Hmm.
But
It's just
it's those kind of things that you really have to listen to and pay attention to and really adhere to what they're saying, you know.
yeah, for most of the part, like you said, it's pretty safe and they tell you where to go and where not to go.
Right.
But
Right.
there
We
are
were
times,
very safe. Yeah.
yeah, there are times where like you obviously stand out that you're not from here, you know.
Yeah, and as long as we stayed in our we stayed like almost on a compound basically. And as long as we were with the group, we were fine. Um, However, we were able to see planes that touched down for a few minutes and then took right back off, right? And so some very suspicious behavior. We had roosters that crowed in the middle of the night, you know, like 2 or 3 in the morning all the time. So, you know, you have interrupted sleep at times, you know,
Yeah.
so nothing, there's no air conditioning, right?
No,
There's no
no,
air conditioning. There's no common amenities.
no, yeah. Now the trips that I've gone to where Mercy Ships has put us up, there's air conditioning and I have a bed and it's kind of like a little Motel 6. It's very nice for what they have. When I went to Kenya, I went we, like you said, we were on a compound and they wanted us to stay on that compound within the walls and don't leave. And
Right.
we were on mats on the floor, kind of like almost like a camping mat on the floor. And there was bugs everywhere. And,
Yeah.
the government shut off the water at 8 p.m. And it
Right.
was like, okay, so if you, it was a different experience. I was much
Yeah.
more grateful when I got back.
Right.
Yeah, much more grateful for what we have. And I always take pictures and show the students, do you see how spoiled we are?
Right. Right. Yeah.
So
I think it's a wonderful thing to have. I mean, it's so easy to just get so narrow-minded. Like even in the United States, like I come into a location and somebody's been here for 15 years, right? And they have no idea. I'm like, when was the last time you've been to SCMS? Oh, I haven't been. Oh, wow, you ought to go. You know,
yeah,
it's a
yeah,
wonderful place to meet other people from other states that do things a little differently. It just opens and broadens your perspective. It's a wonderful thing to talk about how things are done differently because gosh dang it, there's a million different ways to do things. And then when you broaden it even globally, just amazing. Just
right.
amazing.
And
You
and
know?
most of the countries, like we talked about, they're grateful to have you. They're happy to have you contribute whatever you can to their knowledge base. The only country that I went to that they were not happy to have us was Trinidad and Tobago, and that was during Zika. And I try to explain that like that's like somebody coming into your house and telling you, you're doing your dishes wrong, you're making your bed wrong. That's kind of what it felt like because these sonographers were trained on the job, and that's just what they did there. They didn't have school.
Right.
So
Right.
they just knew what they knew. And they were, for these OB ultrasounds, we're only taking three pictures: heart rate, placenta, and fetal position. They're not looking at any anatomy. And, we're talking about during Zika, you had microcephaly, we had cataracts on the eyes, we saw, um, hyperpigmentation on the brain, bleeds, we saw all kinds of things. And we're trying to show them what to look for, and they would just leave. They were like, okay, well, if you want to do the ultrasound, we're just going to go ahead and go home. And I'm like, but I'm only going to be here a week. You have to do this when I'm gone. And we're doing the NICU heads up, trying to show them how to do a baby head because they'd never, done a neonatal head. And they were not enthusiastic to have us there. I'm sure it felt like we were telling them, you're doing it wrong.
Yeah.
So that
It
was not
depends
that
on
was
how
not our
well
fit.
they're prepared,
Right.
right? Is it their idea for us to come or is it someone else's idea,
No,
right?
it was the government's idea. They worked with the World Health Organization. They did have a pandemic, but I just somehow I don't think the knowledge was bridged appropriately, that or the expectations. Maybe they thought we were coming in and doing something else, but I
Right.
don't and all of these trips I make, contacts like you talked about, network with people, and they still WhatsApp me and ask me questions or email me, and we trade knowledge or cases back and forth. They'll tell me about interesting cases. But I still talk to the radiologists from Trinidad, but the sonographers never kept in contact. I think they were just unsatisfied with somebody coming in and trying to tell them you really need to take all of these documented images. And I'm like, well, we don't do that. Okay. You know,
Yeah. Yeah. Changing their mindset is in 3 days or however long you have is next to near impossible, right?
right.
It's hard to get them
And they're already working in limited conditions with, horrible
right.
machines compared to what we have. And, they're just frustrated. I get it.
Yeah. Yeah. Which it can be frustrating for us too, because we want to do more than what we were allowed to do or able to teach or whatever. And so you have to just be able to stand down and like
Yeah.
let it be what it is, right?
Yeah. I left a lot of educational materials behind, a lot of books, a lot of protocols, and thought, well, maybe if they want to absorb it when I'm here,
Mhm.
maybe they'll pick up a book or, this PowerPoint that I left when I'm gone. So
Awesome.
hopefully it'll change, improve somebody's.
Yeah. Yeah. That
That's
would be amazing. So
yeah.
tell me about this Mercy ship. Is this
So
a ship that takes all the medical supplies with you? Is that what you're
So Mercy Ships, you can look it up at mercyship.org. They have converted, well, the first ship that they had, they converted an old cargo ship into a hospital. So that ship actually has 8 ORs. They've got a functioning CT and X-ray. They've got ultrasound, and it's fully run by volunteers. They're all missionaries. All the doctors on there are volunteers. Some of them go for 6 months. Some of the surgeons I met have been on that ship for 20 years. So they primarily go around Africa and Tanzania, but they're in Guinea right now, but they go all around Africa and just serve. They do a needs assessment first. They know a year ahead where they're going to go. So they send a crew out, find out what the needs are there. Do they have a lot of obstetrical fistulas? Do they have a lot of, they have a lot of malnutrition. So they have a lot of bone issues or
orthopedics? I was going to say, yeah.
orthopedics is huge there. But they find out what they need, and then they build up what they need. Do we need ultrasound to come in and do training? So I don't actually go on the ship and live on the ship like they do, but I go in and train them on the ship, and then I come back. So I'm a part of the medical capacity team. So they call me about once a year, and I do that kind of thing. And sometimes they don't need me, like they didn't need me this year. So I've just done some educational webinars for them. But yeah, so it's fully, and now they have three ships. So it's grown, and they have three ships that travel. And they have, I mean, their OR, they have more ORs on that ship than the hospital I work at has.
Oh, wow. That's amazing.
It is amazing. And these people just live on the ship, and they have families and kids that get schooled on the ship. It's crazy. But yeah, it's a whole little community, and they just all travel together, and the ship is docked somewhere for 9 months, and they serve that community, and then they pick up and move on to another country. So, and they don't charge them anything. They're
Wow.
completely run by donations. And the people that work on the ship are completely sponsored, usually by somebody back home or their church back home. They have to pay to live on the ship.
Right. Right.
So, because all their food and their housing and everything is
Right. Kind of like a missionary, right? You have to get
it, it
sponsors and different
mhm.
things. Yeah.
And like I said, sometimes they'll send out emails. We need respiratory therapists for 6 months, and then I always thought maybe when I retire, I'd be able to do that for 6 months or a
Yeah.
year at a time. But I'm not in that position to go for 6 months, so I just go for
Right.
2 months when they need me. Yeah,
Amazing.
yeah. But yeah,
That's awesome. Yeah. Let's see. I'm just looking at all these different places. Cameroon, you did
mhm.
a lot of work. Senegal.
So Jamaica, Trinidad, Tobago, Senegal, Cameroon, Kenya, Albania was in November, going to Guatemala in October, and maybe in the Vietnam area, maybe 2027. We're just kind of talking about it. I don't know that that'll come together. A lot of the ones that we talk about, it doesn't always come together. We don't always have the people that we need to put it together, but it's in the talks right now. So maybe Vietnam in 2027.
Oh, nice. Yeah.
Yeah.
So the OB ward, can you tell me about that when you went? Like when I went to Honduras, it was this big long room with all these beds in it.
Mm-hmm.
That was the OB ward. Like they just came and had a bed to deliver their baby, but no IVs, no um
Epidurals.
monitoring, no epidurals, nothing. And
Nope.
to get there, they would most likely ride on the back of someone's motorcycle. And these roads, when you talk about putting a machine on the back of a truck and getting to you, I mean, it's bouncing all over the place, right?
Yeah, they're dirt roads. It's like
Yeah.
off-roading.
Yeah.
Yeah.
They're not paved, easy roads, you know? And so
No, and
it's the same with OB patients. I mean,
yeah, and
they're on the,
everybody there, everybody, at least in all the Africa countries, they all ride on motorbikes.
yeah,
And it's not unusual to see like a family of four on one moped.
right,
And
right.
when I was in Kenya, the funeral home was right across the street from the hospital, and I actually saw them bring a body on a moped. Like there was a person driving the moped, there was somebody wrapped essentially like a body bag, and then a person behind him. So the cadaver person was sandwiched between it. And I said, "Is that a body?" And they're like, "Yeah, they're going to the funeral home like it was nothing." I'm like,
Yeah,
"Oh my god, yeah." But no, the OB patients, like you talked about, they just come in labor in a bed, and no IVs, no monitoring or anything, and they have their baby and go home.
yeah.
And one
So
of
as a result, not a lot of them make a huge effort to get to the hospital, right?
a lot of them have home births.
Right.
A lot of them have home births. And one thing I guess I didn't really appreciate, um, I don't know if it was like that in Albania, but I know all of the African countries I've gone to, when their loved one is in the hospital, they have the family is the one that has to feed them.
Yes,
So,
come take care of them.
here,
Right.
here when we're in the hospital, the cafeteria, you're on a liquid diet or whatever, low sodium, they'll bring you your food. Not there. If you don't have a family member that will purchase your medicine at the pharmacy and bring it to you, you're not getting it. And if you don't have a family member that will cook and bring food for you, you're not getting it. The hospital doesn't supply that.
Right. And they don't have a nurse to take care of you. Like the
No.
family comes to take care of you while you're in the hospital.
Yes.
Yeah.
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 It is a quite different than what we have. I'm much more appreciative for what we have. They do have nurses, but they have a different role there
Right.
than
Right.
ours do. They don't really monitor them or check in with them like we do.
Right.
Yeah.
Right.
Yeah, it's I love it because I learn something every time I go, but there's always some that just really tug at your heart that you're like, really? We can't do more here,
Right. Right.
When we went to Jamaica to do AV fistulas, and then we did something crazy, like the surgeons did like 62 surgeries, AV fistulas in 4 days that we were there because
Right.
company that we went with donated some dialysis machines, but they didn't have a way for them to have the fistulas. So we were doing all the vein mapping and screening all these people ahead of time for the fistulas. And one of them was a 13-year-old little girl that had lupus. And so I did her vein mapping and everything. And I was trying to when you do these medical mission trips, you take on the role of nursing. I mean, I'm charting
Right.
things,
Right.
taking pills, I'm doing all the things, and I'm charting all of her stuff. And one of the doctors from there came over and said she's not on the list. And I said, "Oh no, I've got all her stuff." And she said she has lupus. She's not getting it. So she already had an autoimmune disease. So they just discounted her. She wasn't going to get dialysis. I
Wow.
was like that. I mean, in a country like that, that's kind of a death sentence.
Yeah.
You're an end
Yeah.
stage renal failure, you're 13 and you have lupus. And here, lupus isn't that big of a deal. I mean, it's chronic, but
Right.
not unmanageable. There, it's a big deal.
Yeah.
So they just
Wow.
took her right off the list. And that was like the saddest thing. I'm like, can you just come with me? I'll take you to Texas. Lupus is not a big deal in Texas.
Yeah. Oh my gosh.
But yeah, there's a lot of stories like that.
Yeah. A
Because
lot of our,
the government owns, the healthcare system. And so if they say you're not getting something, you're not getting it.
right. Right.
A lot, we
And
don't
the
have it.
government is so corrupt. So from my experiences, I don't know if this is everywhere, but from what I've heard, there's multiple places like this where you can excuse me, you can have a business and make money, but then the government will see that you're making money and they'll come and say, you owe me this much money for taxes, and they'll take all their money. Right. And so there's no like the government gets 33% of there's no tax brackets, right? People just come and knock on the door and we need money for the government and you have to give it to them, right?
Mhm.
And
And
so it
and a
makes
lot of
it
times
hard for
they'll
them to make a living.
well, and not only that, but it's hard for them to get supplies. Like we talked about, like
Right.
medications and stuff. I know in Trinidad they had a big problem with Venezuela. So they would order medications and either they would get bypassed and get rerouted to Venezuela, or somebody in Venezuela had a connection and they would take their medications. The whole hospital didn't have CT contrast where I was. They hadn't had CT contrast for almost 6 months.
Wow.
And here we do almost everything CT with and without
Right.
contrast. And it was like, you guys don't have contrast? And they said, oh no, we have the capability of it, but we
Right.
can't get it.
Right.
Every time we order it, it gets taken. And taken could mean stolen or rerouted, but they're
Or
definitely not getting,
resold for,
yeah.
yeah.
And so a lot of times when these, the people that I'm working with in their country, they find out I'm coming, they'll say, can I Amazon stuff to your house and you bring it to me? And
Right.
it can be anything from, baby diapers to
Right.
walkers to medical supplies. And I'll just take it.
Shorts.
Yeah.
Shorts. I brought some of the people over there shorts or hats, certain hat or something. But I mean, some of these people who work with you on a medical mission, who are in the country, they can start to maybe take advantage of you as, oh yeah, bring me a lands in hat, blah, blah, blah. And I'm like, how did you know that even existed?
There are some that, they'll ask for some money while I'm there. And if I have some, like $20 for us isn't that big a deal. For them, it could be a big deal. So I
Right.
don't mind. But then it doesn't happen often, but I will have some people that every once in a while, somebody WhatsApped me about 4 months ago and said, I'm in dire straits. Can you, Venmo me $100? Well, first of all, I don't know you that well, and I
Right.
don't want you to have access to my Venmo, and don't you have anybody else closer and that almost, that's rare, but I mean, sometimes that
Yeah.
does happen, you know,
Yeah.
they
Yeah.
just still
You
have my
do have to be
information.
careful with that.
Yeah.
The relationships, sometimes they're using that relationship just to get more things from you. So you kind of, not all, but I think
No.
you have to kind of be on guard that that's
Yeah.
how things can go down as well.
Yeah. And there's more good than bad. But like we
Right.
talked about, when the first time I said I was going to Jamaica, everybody's like, well, Jamaica's not a poor country. Like that's a tourist country.
Oh,
It's a tourist country if you're on that side of it. If you're a native
right.
person that lives there, it's a very poor country.
Yes,
And
very.
same thing with Albania. They're like, well, that's Eastern Europe. That's right by Italy. How's that poor? Well, they were under communist rule until the 90s. And so when they took that away, everything kind of crumbled.
Right.
Their doctors there that I worked with last November, they make the equivalent of 18 or 800 US dollars a month as a physician.
Yeah.
and they have to have, these are people that have families and like we couldn't live
Right.
off of $800 a month here unless
Right.
you're a college student,
Right.
and so
Right.
that's just crazy to me. So a lot of them have the physicians have multiple jobs. They work at multiple, a private hospital and a public hospital, or a public hospital and a university, because they have to, have more than one job because they can't make it as a doctor.
Right.
It's just crazy to me.
Yeah. Yeah.
So,
That is amazing. Tell
yeah.
me about the documents that you need to have if you're thinking about doing a medical mission trip, or what kind of things would you have to get ready for in order to go on that?
That's a great question. So you have to have a passport, and you have to make sure your passport doesn't expire within 6 months. So if I was going, like I'm going to Guatemala in 3 weeks, if my passport was going to expire in 6 months, they won't let you travel because they're worried you'll get stuck there. So you have to make sure your passport, they're good for 10 years, but make sure it doesn't expire within 6 months of your travel. A lot of countries I have to get a visa. So like not for Albania, but for Kenya, I had to go through their Ministry of Health and apply and get a visa for their country. And then you obviously have to have all your vaccinations. Some places, like Cameroon, I had to get my yellow fever shot and keep that card with me that stays with my passport. Most of the countries that are in Africa, you have to take the malaria pills before you go and while you're there. And that's always, they don't tell you have to do it, but it's recommended. One of the girls I went with didn't want to take them, and she got malaria while she was there, and it's treatable, but it's miserable. So I
Yeah.
would just rather take the prophylactic. But pretty much just your vaccinations, your passport, and then a visa, depending on the country,
And COVID, right?
and COVID. So we had a trip planned to Senegal. We were supposed to go in 2020, and we were supposed to go the week that the whole world shut down. So that got bumped back to 2021, and then it got bumped back to 2022. And so when we went in 2022, we still had to be quarantined for 10 days once we got there, which was so kind of wasteful because I only had 2 weeks to be there to be quarantined for 10 days.
Right.
And then we had to get tested morning and night for COVID, because if they got it on the ship, everybody was going to get it on the ship.
Right.
I
Right.
understand that. But yeah, most places still. Now, when I went to Albania, they did not ask for my COVID. I did tell them I had it, but they didn't ask for proof of it. But some places still will. And now COVID's making a resurgence this summer. So we're starting to see more people ask for COVID vaccines. In fact, the people for Guatemala asked if I was vaccinated for COVID. So it's coming back.
Wow.
Yeah.
So, you have a list of multiple organizations that do this. This is amazing. What a
There's
list. I had no
so,
idea
and
you
those are just the ones that
travel with any of these people.
those are just the ones that I know about. So I did a lot of volunteer work with IFSR, which is the International Foundation for Education, Sonography, and Research. And when I worked for Sonosite doing commercial ultrasound and was clinical applications. One of my really good friends, Lonnie, did some medical mission trips, and so she's the one that's like, "You can do this with ultrasound." I'm like, "What?" So that's what kind of led me down that path. And then when I was with IFSR, they're like, "Oh, we have a lot of people that need volunteers, but nobody wants to volunteer." And I'm like, "Why not? I'll go."
Okay.
I started going with IFSR, who kind of connected me with Mercy Ships. And so I still
Okay.
work with Mercy Ships some. Hope Imaging is a group of radiologists that sponsor sonographers and radiologists to go on these trips. I've done some with the World Health Organization under PAHO, so the Pan American Health Organization, just Hands for Humanity. There's all kinds of different ones.
Yeah.
Um, but yeah, you just kind of need to like Google search ultrasound medical mission trips, and you'd be surprised what would come up. And they don't all work out. There's some that they'll
Right.
ask me. I had somebody ask me a couple weeks ago if I could go to Kenya like in a month, and I'm like, see, I need like a year to build up for a Kenya trip.
Yeah.
But somebody had backed out at the last minute, and things happen. And they don't always need like, I do everything but echo, and sometimes they just want echo, and so I have to clarify you need an echocardiographer, not me. So yeah, but yeah, there's so many organizations. So if anybody's interested in it, there's many things you could Google and get in contact with people.
Yeah.
Yeah.
Yeah. So, what does it usually cost you to go on these trips?
It depends. I've had like When I went with Hope Imaging the first time, they paid for half of my trip and I paid for half of it. And then if you continue to work with them, they'll pay for the whole trip. Mercy Ships, when I went with IFSR, they would usually give me $1,000 towards my travel and then I had to pay for the rest. So usually when it's all said and done, it's anywhere from 2,500 to 3,500 out of pocket. I just kind of look at it as, some people donate to their church or to their charity of their
Right.
choice. This is just kind of my charity that I give to, and I donate to Mercy Ships also. But that's how I kind of look at it. We just got back from a vacation in Europe, and I was talking to some of the people there, and they're like, "Do they pay you to go on these trips?" And I said, "No, I have to pay." And they're
Yeah.
like, "That's crazy. You pay to," and I'm like, "Yeah, I have to use my vacation time from work, and I have to pay with my money." But to me, I mean, I just get so much more from it than I give.
Yeah.
So to me, it's worth it. It's not everybody's cup of tea, but I really enjoy it. Yeah.
Yeah, and they're so resourceful sometimes. The people that you meet, some of the gifts that I bought, bowls that were made out of pine needles that they would wind colorful thread around, right? And these sturdy bowls, like for bread basket or, to carry whatever. Um, it's amazing how resourceful they are and how talented they are. And in the end, it comes down to we're all human, right? And we all are creative and we can all get through the hardest of times,
Definitely.
whatever. Because some of their children, if you watch their children, are still so happy.
Oh, I know.
And
There's some
they're
of the
kicking
happiest
a
people.
dirt rock around, you
There's
know?
Yeah,
They
definitely.
wouldn't know a Walmart, or they think, a ball would have been like luxury, you know?
Yeah. No, they are so resourceful and I've seen people make flip-flops out of water bottles. Like our water
Oh,
bottles that we use, they make flip-flops out of them and wear them just like we wear flip-flops to the store. And I'm like, that is crazy. But I mean, they have so much of that stuff.
right.
They're just very resourceful and they're so grateful, genuinely thankful.
Yes.
When I was in Albania, it was actually over the week of Thanksgiving, which just worked out well because I was off of school that week. So, of course, Thanksgiving's not a holiday in Albania, but
Right.
for the two radial or the three doctors I was with and myself, they're like, well, we're going to throw a Thanksgiving holiday dinner for you. So when we got done at the clinic, one of the doctors had all of us, which was all of us and the whole clinic staff, which was like 16 people, literally walked to this lady's apartment and she just put together I mean, if I was going to put together a Thanksgiving dinner, girl, for like 16 people, it'd take me a couple days to plan that.
Right. Right.
She put it all together and
Yeah.
her neighbors brought over stuff like a big old potluck. And I mean, it was like the best Thanksgiving I've probably ever had. And it was not here.
Yeah.
You know? I mean, she did make turkey and it wasn't the turkey that we're used to. And there
Right.
wasn't all the
Right.
things that we have, but it was like the best. I mean, it was the best conversation because I mean, just listening to everybody's viewpoints and some of them had lived through, being a physician during a communist era, which was, an interesting intake for me to hear. So it was just the best
Mhm.
conversation, the best Thanksgiving ever. And it's like, she didn't have to do that. We were just all going to go back to the hotel and have a sandwich. But yeah, it was a great trip.
Yeah.
And they're usually very proud of their country. They want you to see, oh, you have to see this and you have to see that. And
Yes.
it's very interesting, the history and everything. Just I've learned so much.
And they work hard. Like they would pick, in Honduras, they pick coffee beans, right?
Yes,
And
in Sandy
that,
too.
I mean, if you see how to do that, and they got very quick at that, and they were very efficient. And but that was very seasonal, right? This is the season of harvest, and they had to, a whole bunch of them would come and they would harvest, and then they know, okay, you know,
Yeah,
no more work for a while, right? Because they have trouble finding work that people will pay them and be honest with them, right?
right,
To pay
right.
them.
Yeah,
So,
I've seen the hardest working people in these countries. Just
yes.
yeah, it's crazy.
Yeah. Amazing. And, we have probably just gone to some of the major locations, right? We haven't even really traveled back into these small crevices and islands. And, um, I mean,
Oh,
you get lost going
yes,
back into certain little countries and, little areas where they have even less than what we see when we're there in their larger municipalities. So,
Yeah, usually I try to take a day if it's possible to do just a sightseeing. And when we were in Senegal, they took us to Gorée Island, which, back in the 1700s was where all the slave trade came from. And so learning the history of Gorée Island and how pretty much almost every slave that came through Africa, to the, northern continent, North America, came through this little island. And it was just, I probably would have never even heard of that if I hadn't have been over there, you
yeah.
know. You just learn so much, so much.
Yeah. It's just, we live in an amazing world with some amazing people. And I tell you, my heart came back so full and so many different views, right? Like it really puts the whole allowing minorities, immigrants to come into the States. It really is like I really had a really pretty strong view until I went. And then I'm like, I don't know now, you know?
You see a whole different point of view. Definitely, definitely.
Yeah, it makes me rethink some things, you know?
Yeah, and some of my friends that are here that are doctors, they're like, "Oh, those doctors over there must be horrible," and I'm like, "They're actually better clinicians than you guys are." And, my friend was kind of insulted. And I'm like, seriously, like you guys, if you suspect anything, and a lot of it's CYA, but you order labs and imaging and, this and this and this before you even get a patient history. And I'm like, they can listen to the heart and tell me that, there's a mitral valve murmur, or
Yeah,
they can take a probe and look at it and see that there's an MCL tear on the knee. And I'm like, you guys would order a full MRI with and without. And,
right.
they don't have that.
Yeah. They
So
have to
they're
know. Yeah.
yeah, they're much better clinicians, or they have to rely on their
Their
critical
clinical
thinking.
skills, right? Absolutely. And history, getting a good history, I think, too.
Here, they just don't do that. And I know part of it is they just don't have the time, and part of it with our legal system, they feel like they have to, but it's
Right.
just a different, I really enjoy healthcare over there. You get to know
Sometimes.
your patients better.
Yeah.
And
Yeah.
like I said, some of the stories are very sad, but some of our stories here are sad too.
Right.
You know,
Right. Yeah. It's an amazing experience. And I haven't been for quite a while. I think I want to say 2018, maybe. So I might need to start
It-
looking at that again, getting
yeah.
on another list sometime
Well,
soon.
a lot of it got put on the back burner for a lot of people because of the pandemic and,
Right, right.
and things, but it's starting to pick back up again.
Yeah, I was scheduled to go and then the pandemic came and then we didn't ever go back for that at that time. So yeah, so amazing. But it also was very encouraging to me and not that I've done a whole lot with it, but I do have it on my plan to do is to learn another language. Are you bilingual at all?
No,
Yeah.
I did pick up a little bit of Albanian when I was over there. To me, that language is easier to pick up. I wish I could learn French. One of the girls I was with spoke French, besides our translator, and it's such a beautiful language. But
Yeah.
I know just a little bit of Spanish and a little bit of Albanian, and that's it.
Yeah. Yeah.
So, and I only know medical Spanish. Like I can walk you through your whole ultrasound, but
Right.
you
Right.
know, but if you tell me that and I got really good at it when I worked at Parkland, I would, it just flow like a dialogue. And then they'd start talking back. Like I knew what I was, and girl, you could be telling me your house burned down. I don't know what you just said.
Yeah, I know,
I
right?
just know my spiel and like a couple of little answers here and there, but you just went way too fast.
Right, right.
Yeah. But
Well,
no,
thank you for sharing your experiences
thanks for
and
having me.
your strength and hope. I hope this encourages people to want to at least give it a try and
Yeah.
Google all these different places that you can go and organizations you can go with. I know I think it was Christmas week. I interviewed a man who does medical missions as well. Um, and so there's just a lot of opportunities. You do have to notify ahead of time. You do have to think quite a ways out, but it's such a gift to yourself to be able to go and experience another country and other people who do things differently, who don't have what we have and survive and thrive and helps you to see life outside your own little box, right?
I think it just definitely helps you, even if it's not your thing and you don't want to do this repeatedly like I do. I think if everybody in healthcare could just do one,
One,
would
yeah,
just make you appreciate not only what we have every day, like you talked about running water that we can drink, but
right,
our healthcare system that we get, when we work in it, we get very frustrated with it. But when you see through the lens of somebody else, we are so blessed.
right,
And
right.
it really helps. It really helps me, reset myself every year.
Yeah, it fills my gratitude journal rather quickly, right?
100%, 100%.
And yeah, just so grateful for what we do have and causes me to really want to give more or do more, right? Because we do have so much.
And a lot of it, a lot of people, you don't even have to go on it. I've got a friend that she's like, I have no desire to go on those trips. Okay, that's great. They still ask for people to put together webinars. I
Right,
just had somebody
right.
ask me, could you do an abdominal Doppler webinar? Sure. Tell me what you're going to be doing it for. Liver transplants. What are we doing? I love that stuff. So even if you can't go there, there's still ways to give back.
Absolutely. Absolutely. Well, thank you so much, Brandy. I certainly appreciate it. I'm so glad that we could connect and that you could share your experiences and what you've learned and what you do to give to others. And we certainly appreciate that. Thank you. Thank you for tuning in to It's All About the Frequency podcast. I hope you enjoyed today's episode. Share it with a friend and remember to keep your frequency high.